Good morning, everyone, and welcome to Indiana Ship's Medicare Monday. I'm Susan, and I'm here in Indianapolis, and I'm joined by my co-hostess, Megan Rogers, who
Good
is
morning.
in North Central Indiana this morning. And we're so glad you joined us. And Megan has prepared a terrific presentation on preventive health services that you can get under your Medicare benefits, especially for women. It's the month of mothers, May, and we thought we would talk about some specialty ladies services. So just a reminder that you can always chat in your questions and Megan will address those. And if you're not watching this live, then you can just still put them in and we will monitor that and get back with you with answers to all of your questions. So without further ado, Megan, what can you tell us about women's preventive health? And good morning.
Good morning, Susan, and happy Mother's Day to you and all the other mothers out there watching. All right, so let's talk about preventative care specifically for women. So first, some stats. I like my stats. I'm a nerd. So the ACA requires plans to cover many preventative services without cost sharing, meaning copays. So you'll have these services completely covered at 100% by your insurance plan. So these are cancer screenings, these are chronic condition screenings, healthy behaviors counseling, vaccinations, reproductive health services, and even pregnancy-related services. Now, that one we're not necessarily seeing a lot with Medicare individuals, but it certainly could be possible, especially since Medicare is for individuals that have disabilities as well, so you might be younger. And then 4 in 10 women are unaware that there are preventative services with their insurance. So ladies, make sure that you are checking annually what preventative services are covered in your insurance, Medicare or other. And if you are new to an insurance provider, check to see what they cover as well. So preventative care is care that you get to prevent illness, to detect medical conditions, and to keep you healthy. This is a service that is considered preventative if you have no prior symptoms of the disease. If you are having symptoms and you're going to your doctor to diagnose what those symptoms could mean, that's diagnostic. And then Medicare Part B. Part B is our outpatient part of Medicare. This covers many preventative services, including screenings, vaccines, and counseling. So we have a couple different kinds of Medicare, which you may know from our previous Facebook Lives. But we have original Medicare, which means you get your Part A, which is your inpatient hospital insurance, and your Part B outpatient insurance covered by the United States government. And then we have Advantage plans, and these are ways to get your A, B, and D, which is your drug coverage, covered by your Medicare with a private insurance company. And both ways of having your Medicare provides preventative services. So everything that we talk after this slide would be covered by original Medicare or the Advantage plan. So for original Medicare, preventative services that Medicare covers at 100%, you do not owe that deductible, you don't owe a copay. Now you do have to make sure that your doctor takes assignment, and this means that they are in network with Medicare and they are okay with getting that Medicare reimbursement amount, which is usually a reduced payment back to Medicare and is not that full amount of the office visit. If you receive services that do have a cost, these providers cannot charge you more than the Medicare approved deductible and coinsurance. And then Advantage plans. So beneficiaries should not be charged for preventative care services that are free for people with original Medicare, as long as you see in-network providers. If you go to an out-of-network provider, most likely there will be a charge. So you want to make sure when you have Advantage plans that you're checking to make sure that your providers are in-network or out-of-network, so you know what's going to happen once you see them. Going to an out-of-network provider may cause causes to be applied to preventative care services that otherwise would have cost nothing. And one thing I get, we play Medicare bingo from time to time as a fun presentation. And we talk about like mammograms and colonoscopies in that. And when I started doing the Medicare bingos, I got people telling me, well, I got a bill for my colonoscopy, or I got a bill for my mammogram. Well, as we discussed it, it was the fact that it was the diagnostic versus preventative battle. So they were going to their doctors saying, hey, I've got symptoms. So the procedure was done. And because it was diagnostic at that point, they did get a copay. So that's also important to keep in mind. In-network doctors, assignment, and if it's a preventative or diagnostic test. All right, so these are most of our preventative services that are covered by Medicare. And these would apply to both women and men. So we have our Welcome to Medicare visit, and we have a yearly wellness visit. And we're going to talk a little bit more about those definitions in just a minute. We have alcohol screenings and counseling. We have bone mass measurements. We have cancer screenings, heart screenings, depression screenings, diabetes screenings. We have vaccines, so our flu shot or hepatitis B. There's pneumonia shot, there's COVID boosters, RSV vaccines as well, obesity screenings, tobacco use, counseling. So a lot of good preventative services are out there that's covered by Medicare. But let's talk a little bit more in depthly about some of these. So first, we are going to start, if I can get my slides to move forward. We are going to talk about our Welcome to Medicare and annual wellness visit. So my mother-in-law just turned 65 this month. So she is about ready to get onto Medicare, and she saw her doctor for her annual screening on her normal or her employer insurance. And he goes, oh, you're turning 65. Well, you make sure that you see us in the next year for your Welcome to Medicare visit once you get on Medicare. So she will be doing that, but she got a chuckle on that. So first, our Welcome to Medicare. So this Medicare covers one Welcome to Medicare preventative visit within your first 12 years of having Medicare Part B. And then after that ongoing, Medicare covers an annual wellness visit once you've had Part B for a full year. Both of these visits are covered at 100% by Medicare, as long as the provider is in network and takes assignment. Now, what we tell people is these are not head to toe physicals. Some people don't mind these, and some people can't stand these because, again, they're not the head to toe physical. They are a time mainly to review things with your provider. So with your Welcome to Medicare visit, you're going to review your medical and social history, as well as your current health status and risk factors. Your provider is going to give you resources related to your risk factors and your health needs. And then you're going to get a checklist or a plan with information about preventative services that you might need in the next 12 months. So our annual wellness visit is along those lines. So it's a yearly appointment with your provider to create or update a personalized prevention plan. And this plan is going to help prevent illness based, again, on your current health and risk factors. You will be provided with resources related to your risk factors and your health needs. And you want to make sure that you're prepared when you go to see your doctor with your medical history, your family history, list of medical providers, prescribed medications you take, and any durable health equipment that you use, like walkers, canes, grab bars, wheelchairs, bedside commodes, toilet risers, equipment like that. Now, if you've been with your provider for a while, that provider probably already has this listed, but if you do see other providers that are maybe prescribing other tests or maybe prescribing other medications, you want to make sure that your primary is aware of all of that. So let's talk about some preventative health services that are specific to women. Susan, do you have a question for us?
Yes, Sean asks, and good morning, Sean and Terry. Sean asks, says that she's had several clients tell her that their Medicare Advantage plan makes them get a wellness exam. Has this been confirmed?
Well, Susan, you correct me if I'm wrong, but I do not believe it's required by Medicare, but I have heard rumblings that Advantage plans appear to make it seem like it is a requirement, but I don't believe it is an official requirement. What have you heard, Susan?
I've heard that same thing. And my neighbor is a nurse practitioner employed by an insurance company that offers Advantage plans here in Central Indiana. And part of her job is doing home visits to do those wellness exams. So yeah, I'll have to ask her how they bill, but I believe that you are true. Years ago, many Advantage plans offered money. They gave their enrollees $25 if they would have their annual wellness exam. So
that is a fun incentive.
yeah, especially if somebody's just going to come to your house.
Exactly. Yeah. Well, we'll keep an eye out on that, Sean, and see what we can figure out. But at this point, it's not an official requirement as far as we know. Good question. Are there any others right now, Susan?
Yes, I did have one that was texted in earlier, and I didn't quite
perfect.
Signal that I had one. When you talk about being in a provider network, Jane wants to know how you know if a provider is in the network.
Ooh, good question. So there's a couple different ways. So if you're with Original Medicare, you can look on medicare.gov to see if your provider or providers take Medicare A or B. And then if you're with an Advantage plan, there's multiple different ways you can determine this. You can call the doctor's office and ask them if they take United Healthcare PPO plan choice 1 or whatever that Advantage plan is called. Or you can go on their website. You can also go on the website of the insurance company that you're with if it is an Advantage plan and check. Or you can call the insurance company. Or sometimes, not always, but sometimes you might get a book from the insurance company that will let you know providers that are in network, but that can quickly become outdated. So looking online or calling the insurance company or calling the doctor's office is usually the best way to go. And if you are with an Advantage plan, it's not good enough to ask, do you take Medicare? Because you do have Medicare, but you have a private insurance company managing those benefits. So you have to give them the specific name and or the plan ID number of the Advantage plan that you're with.
Yeah, excellent detail. Those are all good things to know. And further, when you're talking about accepting assignment, how do you know if your doctor accepts Medicare assignment?
That is another good question. So you would want to call that doctor's office you're going to ask them, do you take Medicare? And then you're going to say, okay, well, do you take Medicare assignment, kind of like homework assignment? And they should know. And they're either going to tell you yes or no. And if they take Medicare, but don't take assignment, you can still see them, but you might be subject to something that's called excess charges. So Medicare is going to pay their portion. You'll pay your normal copay, and then you might get an additional copay of up to an extra 15%. Now, if you have something called a supplement, your secondary Medicare insurance, you may not have to worry about those excess charges. But you do want to be aware of them and know if you owe that or not. So great question, Susan. So we're gonna move on with our specific screening details on some certain preventative health screenings that are specific to women. So heart disease is the #1 killer of women, and heart attack symptoms can come across different in women than they do for men. So it's important to know what some of those symptoms are and be aware of those. So, this slide shows some of those symptoms: shortness of breath, cold sweats, upper body pain, unexplained fatigue. Of course, I'm always tired, so who knows if it's unexplained or explained. Dizziness, nausea, or vomiting. So just be aware of that. And Medicare does cover cardiovascular disease screenings, and Part B specifically covers these blood tests once every 5 years for women. So now we have some specific cancer screening, so cervical and vaginal. So Part B covers Pap tests and pelvic exams to check for these specific cancers. As part of the pelvic exam, Medicare also allows your physician to do a clinical breast exam to check for breast cancer. And Medicare will cover these screening tests once every 24 months in most cases. If you're at high risk for cervical or vaginal cancer, or if you're of childbearing age and had an abnormal Pap test in the past 36 months, Medicare covers these screening tests once every 24 or 12 months. And then Part B covers the HPV tests as part of the Pap test once every 5 years if you're between the ages of 30 and 65 without any HPV symptoms. A little bit more on the HBV. This is the hepatitis B virus. Your Medicare will cover this screening if your primary care doctor, sorry, I'm gonna move my camera, orders one and you meet one of these conditions. You're at high risk, and you can always talk to your physician about what would make you high risk, and you're pregnant. Mammograms. So ideally, you should have a baseline mammogram once in your lifetime between the ages of 35 and 39. There's the screening mammograms, which are the preventative mammograms that you should have once every 12 months if you're 40 and older. And then if you're having symptoms, you're having pain, you find a lump, and you speak to your doctor, these are now diagnostic mammograms, and you can have those more frequently than once a year. Like, if there's concern that, you're having symptoms, again, lump, pain, other issues in that area, then your doctor can order them more often than once a year, but most likely you are going to have to pay a copay or co-insurance for that test. And if you haven't met your deductible yet and your plan has a deductible, you may also have to pay that as well. but it's very important to get. So you don't want to put that off if you do have signs or symptoms. All right, Susan, are there any other questions at the moment?
We don't have any other questions at the moment.
Okay, thank you. So, if you have questions for us along these lines with preventative screenings with your Medicare or any other Medicare insurance questions, you can call our call center at 1-800-452-4800. You can also visit our website, medicare.in.gov, or you can follow us on social media. But again, if you're watching us, you probably already do that. Our videos stay on Facebook for a while. And then we do have a YouTube page where all of our videos go as well. We do purge some of them annually based on what the topic is. So we make sure that we don't have outdated information on there. So you can visit us on our social media or website, call our call center, and get connected with a SHIP counselor. And like Susan said, if you are watching the recording later and you have questions, you can comment in on the chat box, or you can Facebook message us and we will respond to those as quickly as we see those. So Susan, I am going to turn it over to you to wrap us up and tell us all what we have coming up next.
Thank you, and thanks for your great presentation today. I would add that we do have a terrific resource that we're happy to mail you, and it's a brochure that lists all of these preventive services. So if you just call our toll-free number, we'll be happy to pop some in the mail for you. Okay, so coming up yet this month, on Wednesday, just in a couple of days, on May 14th, we are going to have an Ask the Expert show. And there will be a couple of experts, maybe an extra expert, to answer all of your questions about Medicare. So get your friends together and see if you can stump those experts. And that's going to be on Wednesday, the 14th. That's this coming Wednesday, 10 o'clock Eastern time. And we hope that you can join us.
Thank you, Susan, and thank you all for tuning in today. We will see you back here on Wednesday.